Hello, I am Nia Lang, and I would like to welcome you to my TED Talk on mental health issues in the minority community. Mental illness refers to a wide range of health conditions of disorders that may affect your mood, your thinking, and your behavior. There are 7 mental illnesses, and these include mood disorders such as depression or bipolar disorder, anxiety disorder, personality disorder, psychotic disorders such as schizophrenia, eating disorders such as bulimia, a trauma related disorder such as post traumatic stress disorder, and last but not least, substance abuse disorders. Substance abuse may include drugs or alcohol. 13.2% of the population identifies as African American. Of this 13.2%, 16% of these people have a diagnosed mental illness, and this is only just in the past year. According to the Health Minority Office, African Americans are 20% more likely to report a mental illness than Caucasians are. The prevalence in the minority mental health field is very high compared to the non-minority group. What I mean by this is Black Americans are more prone to feel sadness and less of themselves than whites are. While Caucasians are sadly more successful at suicide, minorities are more likely to try to commit it. Now that I am done with my facts and my introduction, I would like to say that I chose this topic because mental health in the minority community is not only looked over, but is also not recognized. There are many minorities who may recognize that they have mental health issues, and they often get ignored by not only their own families, but by the medical field as well. That is why it is very important to use your knowledge and research for the best tools that best fit you and help you. When I say ignored by the medical field, I mean that Black minorities and other people may not have the advantages and the opportunities to get the proper help that they need, like Caucasians may have. If you already have no support within your household or your family, how is it possible to correctly heal from what you are dealing with? There are many minority families who do not take mental health seriously. And the reason for that is many older people with the family that have a child that has mental illness, they were not properly treated for their mental illness when they were younger, which is why they overlook what their child may have been going through. This is extremely unhealthy, and this also sadly creates patterns and a cycle that do not need to continue. Award-winning actress Taraji P. Henson is someone who completely understands the importance of mental health in the minority community. She says, people in the African American community have long been afraid to talk about our mental health. We just don't do it. We're told to pray it away, we're told to be strong, and we are told that it's a sign of weakness, or a lot of times, mental health come off as rage and is dismissed or ignored. In order to change this, we must take action. We must communicate. Health communication is the start of making a change. Health communication is the study and practice of communicating promotional health and information such as health campaigns, health education, and between doctor and patient action includes researching with facilities that best fit you. In this course, we have learned why procrastination is not a good thing to do when it comes to mental health. Procrastination is another reason why mental health continues to be prominent in the minority community. Patients often procrastinate because they can be scared, ashamed, or they feel any other way about reaching out in the health field when they have issues. This is taking me back to earlier when I stated that families don't support the children that have mental health issues in their family, which also may cause them to not reach out for help as well. Reaching out and talking verbally is not always a way where we can communicate and recognize the problem, which is why health communication also includes reading pamphlets and other form of things that promote mental illness, and how to help yourself. Health communication is all about advocating and recognizing the problem. This is not only important for the help of yourself, but for the help of someone else as well. Let's lower the percentages of mental health in the Black community on a negative note, and let's increase the percentages of help on a higher note. This is why communication matters. If you feel alone and you don't have anyone to reach out to or talk about your mental health on a professional level, it is always important to know that you may talk to a friend or a family member or anyone else that you think will be there to help you or that can at least sympathize or empathize with you. Ads, commercials, and other posters and infographics are also ways of health communication. Health communication is extremely important, and I hope that this video is something that can help you turn your life around if you truly need help with talking about mental illnesses and other things in your health that may be bothering you. Once again, my name is Nia Lang, and I would like to thank you for coming to my TED Talk.